Common mental health conditions include depression and anxiety disorders, such as generalised anxiety disorder, panic disorder, and phobias. These conditions are called common because combined they affect more people than other mental health conditions. Some of the conditions share similar symptoms, and it's not uncommon for conditions like depression and anxiety to occur together. You do not need to have received a diagnosis of a mental health condition to experience difficulties with your mental health. Everyone's experience is different and can change at different times. Let's take a look at common conditions individually. Depression occurs in 1 in 5 people, and symptoms can be broadly categorized into psychological, physiological, and social symptoms. Depression is typically characterized by persistent low mood and losing pleasure in things that were once enjoyable. Other symptoms can include tearfulness, irritability, a lack of energy, changes in appetite, and problems with sleep, concentration, and memory. People with depression also experience feelings of hopelessness, guilt, and worthlessness, and will often criticize themselves and withdraw socially. In order to be diagnosed with depression, symptoms usually need to have been present for more than 2 weeks. There are also different types of depression, such as peripartum depression or seasonal affective disorder. Peripartum depression refers to depression that occurs during or after pregnancy and can carry risk for both mother and baby, while seasonal affective disorder typically develops during the winter months as a result of seasonal changes and usually goes away by itself. Whilst seasonal affective disorder is not a diagnosable form of depression, if symptoms are left unmanaged, it can develop into a more serious depression. If depressive feelings are interfering with your life and don't go away after a couple of weeks, or if they come back frequently for a few days at a time, we highly recommend that you seek professional support through your GP or other mental health services. Anxiety disorders are the most frequent mental health conditions worldwide, with 1 in 3 people affected at some point in their life. Anxiety itself is a natural feeling of worry or unease that we all experience at some point in our life. For example, we might feel anxious in the lead up to a job interview or an exam. In these situations, anxiety is perfectly normal, but some people find it hard to control their worries, and the anxiety becomes persistent and can affect their daily lives. Anxiety is the main symptom of several conditions, such as panic disorder, phobias, social anxiety disorder, and post-traumatic stress disorder. Generalised anxiety disorder is a long-term condition that causes you to feel anxious about a wide range of issues and situations, rather than one specific thing. People with generalised anxiety disorder feel anxious most days and often struggle to recall the last time they felt calm. Symptoms of generalised anxiety disorder can vary from person to person, but often include restlessness, difficulty concentrating or sleeping, and physical symptoms like dizziness and heart palpitations. Panic disorder is characterised by severe feelings of anxiety, which cause unexpected and recurring panic attacks. Panic attacks cause a rush of intense mental and physical symptoms, which can come on very quickly and for no apparent reason. Symptoms include difficulty breathing, rapid heartbeat, choking sensations, chest pain, trembling, and feeling faint. A panic attack may happen because of a particular situation, or it may have no obvious cause. Panic attacks can be very frightening and distressing, and can lead to people avoiding certain places or situations out of fear of causing another panic attack. If unmanaged, this avoidance can develop into phobias. Obsessive-compulsive disorder is characterised by having unwanted or distressing thoughts, images, or impulses that keep occurring and are difficult to get rid of, and a strong compulsion to carry out or repeat certain behaviours as a way of alleviating the obsession. Common obsessions include being afraid of dirt and germs, worrying that something isn't safe, wanting to have things in a particular order, and thoughts or fears of harming someone else. Common compulsive behaviours might include excessive washing and cleaning, checking things repeatedly, keeping objects that other people might throw away, and repeating acts, words, or numbers in a pattern. Post-traumatic stress disorder is caused by very stressful, frightening, or distressing events. Someone with PTSD often relives the traumatic events through nightmares and flashbacks, and may experience feelings of isolation, irritability, and guilt. They may also experience problems sleeping, such as insomnia, and find concentrating difficult. These symptoms are often severe and persistent enough to have a significant impact on the person's day-to-day life. Any situation that a person finds traumatic can cause PTSD, including serious road traffic accidents, violent personal attacks, and childbirth experiences. PTSD is estimated to affect about 1 in 3 people who have a traumatic experience, but it's not clear exactly why some people develop the condition and others do not. Psychological therapies such as cognitive behavioural therapy and applied relaxation are among the most frequent and effective treatments for common mental health conditions. Medication might also be prescribed in some cases, but you should always consult with your GP for support with treatment referrals. It's also possible to reduce mild symptoms with self-care activities such as exercise, reducing alcohol or caffeine intake, cutting down on smoking, and practicing relaxation and mindfulness techniques. Whilst it's helpful to understand mental health conditions, if you're supporting someone who's experiencing difficulties with their mental health, it's important not to focus on a diagnosis. In some cases, physical conditions such as thyroid problems or vitamin deficiencies can mimic the symptoms of common mental health conditions. It's therefore important to have a non-judgmental conversation with the person about their symptoms, how it's impacting their daily functioning, and support them to seek further help.